Hi, Dr. Marian Owen with Whole Family Medicine. I am coming to you on December 27th, 2021, with an update on COVID. I want to address the Omicron variant and answer some of the questions that I'm getting a lot over the last few days because it has been spreading quite a bit among my patients. And this is the first time I will say that my patients have been particularly hit by COVID. So my impression is that it is spreading very, very quickly, and it is spreading to people who have been very, very careful. Because up to this point, most of my patients have been really careful to avoid exposure. So that means that the methods that we've been using aren't necessarily as effective as they have been. So we need to increase our self-protection to avoid getting infected or spreading it to other people. So I have had many cases in the practice the week before and through Christmas week. And again, this is the first time I've had this kind of spike. So Omicron is definitely what's spreading around here. It's not coming, it is here. And so act accordingly. We are at the practice encouraging people not to come in unless you have something that we need to examine. If we can interact with you and take care of your problem over an e-visit or a FaceTime call, whatever you prefer, we're going to do it that way. We are, of course, continuing to require masks. That is something that covers the nose and the mouth, is firmly adherent to the face, and attaches around the ears or tied around the head, not simply a face shield. That is inadequate to protect other people. It's inadequate to protect you too, but that can be your choice. It's inadequate to protect others, and I can't have you in my office not trying to protect my staff. You should also avoid any in-person, especially indoor contact that you don't need to have. So people are asking about rescheduling mammograms, rescheduling elective things. I think that's probably prudent. I think you need to make that decision based on, the urgency of your mammogram. And if you have a mass that we're trying to establish, go get your mammogram. If it's just routine screening, you might want to put it off a month. And then also taking into account the protections that are in place at the facility you're going to go to. I mean, if you're going to be the only person in there, one-on-one with a provider who's masked and has good ventilation, and it's something you really need to do, go do it. But use common sense on that. Don't go to the grocery store every day. Consolidate your trips. Get in and out as quickly as you can. If you can afford a food delivery service, that's better for you, although it's asking someone else to assume your risk, and you can decide how you feel about that. I will say about Omicron that so far, given that most of my patients are vaccinated and all but one or two of the patients I've had either had a recent Delta infection or other COVID infection recently, or and only one unvaccinated person do I know of that's not the case, and I haven't seen their course long enough to be able to comment. But in my vaccinated patients, again, that's the majority of the people that I've encountered so far with this, the symptoms are very, very mild. Sore throat, kind of cold symptoms, not even a significant cough. So that's extraordinarily good news. So the vaccine is not preventing infection, it is preventing severe illness, and that's great. So let's continue. If you're not vaccinated yet, please reconsider that, because it is proving to be very, very safe and extraordinarily effective. So I often get the question, what do I do if I'm exposed? And the first thing I want to do is define exposed. Exposed means that you have a known contact with someone who tested positive soon after that contact, not a week ago, but soon after that contact. So if you're exposed in that way, and the exposure was meaningful, indoors, unmasked, or close outside, unmasked, that kind of exposure, it is socially responsible for you to isolate yourself until you have a negative test 5 days after that exposure. And that test should probably be a PCR test, because that's going to be more accurate in an asymptomatic person. If you are diagnosed with COVID, if you get a call back from the PCR or you do a rapid test at home because you have symptoms and it is positive, then you should give my office a call. We have a document that we're keeping up to date as studies roll in about different treatment options, what we find is effective, what is low harm might help, what is high harm probably won't help, and we have that delineated that way for you. You can read through the document and then I can answer your questions. I'm sorry to have to do it that way, but again, I had 6 calls this morning. I couldn't have a 30-minute conversation with all of you. So what I'm doing is sending you that document, asking you to read through it, and then get back to me what you feel is appropriate for you or with questions so that we can expedite me treating everyone. It's just it's kind of a flood every morning, and I just can't handle that level of need for a long conversation every morning and see the patients that I've already committed to seeing. So help me out with that. But call the office, they'll send you the document, get back to us with your questions, and we'll get it worked out quickly. Right now, unfortunately, we don't have an available monoclonal antibody infusion. The ones that were working against Delta and previous forms are not working against Omicron, so they're not being given right now. There is probably one coming, but it wasn't developed in the U.S. market, and it's taking some time to get here. So for now, probably unless you're a senator or something like that, you're not going to get that one. I don't have a way to get it for you. But I'm keeping an eye on that, and we'll let you know when I can. So if you get symptoms of the sore throat, runny nose, cough, body aches, fever, well, it's flu season, it's cough and cold season. How do you know what you have? So I would recommend the first step, if you're symptomatic, is to get, if you can, a rapid home test. Rapid home tests are pretty accurate in the symptomatic state. So if you're having symptoms and that test is negative, it's probably something else. And if you're really sick, come in and we can test you for flu. If it's just a mild cold symptom, then you probably want to stay away from other people because they don't want to be around you when you're sick right now because everybody's nervous. And so, just isolate till you feel better. Do routine symptomatic care, warm tea, things like that I always say in my flu letter. All of that stuff holds. If there's a over-the-counter cough remedy like guaifenesin or dextromethorphan that you like, those are safe for adults. That's fine. Honey's good for cough. If you have questions about symptoms specifically, you can give us a call and we will help you. We can call in cough medicine, of course, if it's severe. If you are asymptomatic and you want to know if this exposure might have led to an asymptomatic infection, like am I going to make my grandfather sick if I go see him, a PCR test is a better test in that setting. So that's one that you have to go somewhere and make the appointment. I know that's hard to get right now, but it's still faster for you to go through one of these drive-through places than to send it through our office, is what we're finding. So they're popping up as the cases rise. There will be more and more of those around because they're making money from that, so they will provide that service. So get there and get that test, especially if you're asymptomatic. Again, if you're having symptoms, the rapid home test is pretty accurate. It's good to follow it up with a PCR, but it's not utterly necessary. Please revisit my previous COVID newsletters, YouTube channel for things that I recommend for prevention, for symptoms and things like that. I don't want to go through everything in this video, but they're all there, and you can view my previous videos. And in terms of symptom management and treatment, nothing that I've previously said is inaccurate. There are some treatments that we would consider now. So again, call us for the document and let us know that you have been diagnosed, and we'll talk about that. I think that's everything. Just be extra careful. Don't panic. Again, it's seeming, my initial impressions, and this is a very small it's a very small number in my study group amongst vaccinated patients. It's seeming to be mild, and that is really hopeful and wonderful, and I hope that continues to show out. But it is definitely on the rise, and we just don't know yet, and so be cautious, be careful with yourself. All right, be well, be safe, and we're here if you need us.